Welcome back to Girl Talk. Many of us think about how we age. We don't always think about our hands. So later in the show, we're going to be chatting with owner of Radiant Skin Therapy, which is where we are today, about how you can avoid aging of your hands and also reverse it if it's already starting. Right now, we're going to talk about thyroid issues, something that lots of women out there sometimes think they have, maybe misdiagnosed. We've got the expert here to chat with us today, Dr. Ashley Woyak with Forward Natural Medicine.
Yep.
So glad to see you.
Yeah, thank you for having me back.
Thank you for being with us. And I think a lot of folks can relate to wondering if they might have a thyroid disorder. So what is the thyroid? Let's kind of start basically.
Exactly, because some people are like, wait, what? It's a gland right around your neck here, so some people will feel like a swollen sensation or something like that. And you might not, but it's really important because it's important for metabolism, like weight gain, weight loss, your energy, and so much more. So
yes, well, I think about all of those things often. So yeah, it's interesting to know if there's something tied to it or not.
And with women especially, it's so common. So it's
why is that?
It's interesting. There are over 27 million Americans have it. About half of them are undiagnosed, and so for women, a lot of times it's an autoimmune issue. So their immune system is attacking their thyroid, and it's kind of, for some reason, women are more prone to autoimmune diseases and having something go wrong in their thyroid. So that's why it's so common with weight issues and things like that. So
yeah, I have a very close girlfriend of mine who had a challenge with being sick for an entire year. So they found out it was their thyroid. So how common is that then for people with thyroid disorders?
Yeah, and very common. So they'll go, it could be years until they're not properly diagnosed, because a lot of times doctors will only run like one lab, like TSH, most women are familiar with, but that there are like 10 other markers you really should be looking at, and so there can be issues with those that doctors they're not catching early enough. So you'll go on with symptoms for a long time without realizing it.
Which is very frustrating, I'm sure. You know you're not feeling yourself, you don't understand why you have this weight gain or weight loss, like you said. How wonderful when you can finally pinpoint it and start a treatment.
Yeah, that's a lot of the women are just like, why am I feeling like this? And they're frustrated because they've been going through it for so long. And
sure, maybe they're doing all the right things, like eating well and exercising.
Exactly.
Sure. So what is the most common thyroid disorder? Because you can have like too much and too little.
Exactly. Yep. There's hypo, hyper, but there's also, like I said, the autoimmune issue with women. So that's Hashimoto's or Graves. Does that sound familiar?
It was a Hashimoto.
So the most common cause of thyroid issues is hypo, so not enough. So that's where you gain weight, you're fatigued all the time, you're depressed, things like that. But the most common form of hypo is the Hashimoto's, so the autoimmune form. Let me know if I'm like losing you. So your immune system is attacking your thyroid, and so to me, it's like, why is your immune system doing that? Let's figure that out and remove those triggers to stop your immune system from attacking it.
And that's what's really impressive about what you do, Dr. Ashley, is instead of just treating the symptom, for, in this case, the thyroid, you're looking at the big picture. Why is this happening at all? And going at it from there. So let's go back to some sort of things, I guess, talking about the medical side and what happens when you go to the doctor. You said they're maybe running one lab and missing other things. So what should they be running?
They should be running for sure TSH, which most doctors do, so that's good, but also free and total T4 and T3. For some listeners, if they don't have any idea thyroid, they might be like, well, that's over my head. But if they do, this is like, they should write these down. So TSH, free and total T4, T3, reverse T3, and all the antibodies. There's 3 different type of antibodies that they should be checking for, and if those are elevated, then you know you have the autoimmune form of the thyroid issue. So, and there's a couple more, but those are the really important ones.
Okay, good to know.
Yeah.
What is the most common question that you receive when it comes to thyroid disorders?
Almost all of the patients that come in and see me, they're like, why are my labs normal, but and my doctor's saying they're normal, but yet I'm having all these symptoms, like why? So I have to kind of go and explain all of it and how it relates to them and their health. So,
And Dr. Ashley, you mentioned some of the symptoms, and if you wanted to talk with her, you give free 15-minute consultations.
Yes, I do.
And you have an open house coming August 1st where folks can come in and meet you and maybe discuss this a little bit more.
Yeah, for sure. Yeah, I invite people to make an appointment for a free consult, or like you said, come to the open house and get to know me and how I can help them.
Or both. Heck,
Yeah,
why not?
yeah. Come on.
Such a pleasure chatting with you.
Yeah.
Again, Dr. Ashley Wyack is with Forward Natural Medicine. Such an expert, such a treat. We'll be right back with more Girl Talk coming up after this, so stay right there.